For 2.6, the four minimum databases, the first would be the PCV or hematocrit. PCV is a percentage of the red blood cells that make up the whole blood. A low PCV levels will be found in cases of decreased red blood cell production associated with perhaps chronic renal failure, decreased red blood cell lifespan, which would be autoimmune or parasitic infection, or also blood loss, either to ulcer or trauma. Increases in the PCV level may be associated with dehydration. For Hardy, the dog in our exam, he falls within a normal range of 37% to 54%. The second test would be total solids or total proteins. This is information on the plasma protein levels. Elevated plasma proteins are associated with dehydration, malignancies, and infections. Decreased levels are associated with inadequate production. Production is done in the liver. Inadequate intake, perhaps due to starvation. Loss related to renal disease, blood loss, or a parasitic infection, or the inability to absorb the necessary nutrients and proteins due to pancreatic disease or irritable inflammatory bowel disease. For Hardy, dog in our exam, he falls within a normal canine range of 5.5 to 7.5 grams per deciliter. The third test would be BUN, which is blood urea nitrogen. It's used to evaluate the kidney's ability to remove waste from the blood. Some anesthetics are either metabolized through the liver or the kidneys. If there's a problem found in the kidneys, this could postpone the surgery or change what kind of protocol we'll be using to anesthetize Hardy. Hardy falls within the normal canine range between 5 to 35 milligrams per deciliter. The fourth test is blood glucose. This is used to measure the endocrine functions of the pancreas. Eating and stress can eating and stress can raise these levels, while fasting can lower these levels. Anything below 40 milligrams per deciliter would be indicative of hypoglycemia. Hardy our dog in this exam, falls between the normal ranges of 80 to 130 milligrams per deciliter.